Hi everyone, my name is Qui'Mara and I'm doing a marijuana infomercial. So, what is marijuana? Marijuana is derived from the cannabis sativa or cannabis indica plant. This drug can take 3 to 8 months to fully grow and consists of 3 strands, which are sativa, indica, and hybrid, which is a mix of both. Each strand gives you a different effect and can react with your body differently. Marijuana contains over 100 cannabinoids. The primary psychoactive cannabinoid is THC, tetrahydrocannabinol. Marijuana can be consumed through smoking, vaping, edibles, oils, and tinctures, which all give you a different type of effect. It is used medically and recreationally in many U.S. states. While it is still illegal federally, on a federal level, it is legal in 38 states for medical use and 24 states for recreational use. So, some facts about marijuana. Marijuana is also known as weed, pot, and ganja. It is most commonly used as an illicit drug in America. And over 52 million people reported marijuana use in 2021. And since then, this number has went up. Medical cannabis is prescribed to treat chronic pain, epilepsy, multiple sclerosis, PTSD, and more. THC concentration has skyrocketed over the past several decades, and sales have increased. CBD is not psychoactive and is now increasingly used to treat anxiety and inflammation, which CBD can provide you with relief without giving you a high effect. Now, your physiological effects. How can marijuana affect you in your body? There are some short-term effects which can happen during the time you're consuming it or after, such as dry mouth, red eyes, a euphoria high or relaxation, altered senses, improved mood and creativity, appetite stimulation, also known as the munchies. Some long-term or medical use effects that can come into play are pain relief and reduced nausea, common with people going through chemo, reduce muscle spasms, improve sleep on insomnia or PTSD patients, and reduce intraocular pressure, useful in glaucoma. Okay, now to our brain, behavioral and psychological changes. How does marijuana affect your mind? Well, there are some positive changes. You get an enhanced sensory perception, reduce anxiety. Those typically come with low doses of THC or CBD, since marijuana is a little bit more stronger. Some negative changes that commonly come with a largely heavy or chronic use would be reduced short-term memory, reduced motivation or focus, delayed reaction time, and also in rare cases, you can have anxiety or paranoia at high doses. Okay, risk and side effects. Always proceed with caution. Respiratory issues can come into play if smoked frequently. Risk of cannabis use disorder, about 1 in 10 users. It can impair your coordination and judgment. It's definitely not safe during pregnancy because it may affect a fetal brain development. Risk of worsened mental health conditions in people with schizophrenia or psychosis. It also can interact with other medications if you are taking other medications. You never know how they can clash or different things that can just come with it. Okay, next, why marijuana can be a good drug. Marijuana can provide relief for many chronic and terminal conditions. It can also improve quality of life. For people who suffer with pain, insomnia, and anxiety, marijuana offers a non-opioid alternative for pain management, important in the opioid crisis. CBD can also help many people with relieving pain with a non-high approach. Growing research and legalization show societal shift towards acceptance, while also encouraging open health conversations and implementing responsible use. Now, how can we use marijuana safely? Well, our do's. Start low and go slow, especially with edibles because their full effect does not kick in until 1 to 2 hours, and you also don't know how the drug is going to affect you. So, also, assure you store the drug safely after use. Let's keep out of reach of pets and children as it could harm them. Don't mix with other drugs or alcohol, and do not drive. Now, use marijuana responsibly. Overall, marijuana has both advantages and risks. Educating ourselves on what we're putting inside our bodies is always best. Let us continue to study cannabis from an evidence-based, health-oriented lens. Stay informed. Thank you for watching my information.